Welcome to EAU Podcasts. In this episode, Dr. Batista talks about the abstract he presented at ICS24, Artificial Intelligence to Read Urodynamic Tracings. Could we seek up a human reading?
My name is Dr. José Batista. I work in Centro Médico Tecnon in Barcelona, and we provide urodynamic diagnosis and treatment in functional urology for patients in the Barcelona area.
Thank you for being with us, Dr. Batista. First, can you tell us about the aims of your study and why you decided to do this study?
Well, we have always been involved in technical innovations in our field. And since many years ago, we had a database with all our patients, with all our urodynamic studies. And we had found a method to classify the patients in a simple way. So we had a lot of data. And in one meeting, we found an engineer from the Canary Islands, from a university in the Canary Islands, who is a specialist in artificial intelligence. And he showed some methods of image recognition. So we thought that urodynamic traces are at the end are images that you could recognize, that you could classify. So given our experience and a huge database that we had with patients classified, we had the images of the tracings and then the diagnosis, we were able to provide them with a good database and a good quantity data to the machine to learn. So this is what they did. We just gave them the data, started with the cystometry because it was easier, was more simple. And we had a good relation with the engineers. So we were able to teach a machine how to recognize the basic urodynamic patterns in cystometry.
So how did you perform the study?
We gave data engineers anonymized data from 500 patients. So the machines were able to learn what were the basic scheme, what were the basic findings of urodynamic traces. So once the machine learned, they actually tried several methods, the Bauch's wavelets, VGG19. There's many different systems to recognize images. And at the end, they found that these two systems were best ones to recognize. So in summary, the data were given to the engineers anonymously, so there were no names of the patients. The machine with different systems learned how to recognize the basic urodynamic patterns in cystometry. And then we gave other patients and see if the machines, if the artificial intelligence systems were able to recognize the patterns. So, and the findings were that we reached an 86% agreement between what the diagnosis was, and we had a diagnosis because we had this huge database, and what their images of the urodynamics were. Not all the systems performed equally well. So the good thing of our study was that we were able to find one system, which is the Bauch's wavelets, that was the best among all the image recognition systems in artificial intelligence to provide a good diagnosis.
And what were the main findings of your study?
Yeah, the main findings were that if you teach the system correctly and in a very coordinated way, you can get a good response and you can get a high reliability, a high coincidence in what the urologist diagnosis was and what the machine diagnosis was. The 15% of incoherence were mainly due to artifacts or to some reading issues. But overall, an 86% is a very high correlation. It's actually higher than what has been previously presented in similar studies.
So according to you, what are the limitations and barriers before AI interpretation of CMG traces can be used in daily clinical practice?
I think there are good, like an initial scanning, evaluation of the traces that can divide. But of course, there's no way that an artificial intelligence system can sign for that report. So it usually needs the human, the specialist signature at the end. So they help us to shorten time when we review the traces, when we do a report, but they are not able to do it automatically. they still need to be corrected. And especially when they need to be corrected is difficult cases or cases in which there are artifacts. So that you will always need a human mind to review what the artificial intelligence does. I would like to add that it's important to create a good artificial intelligence system that you summarize and you structurize very well your data. If you have mixed data, if you have incoherent diagnosis or things that are not properly organized, then you will end up with a mess. And that can be very, very frustrating. So in order to have a good artificial intelligence system, you need to have first human intelligence and to have your ideas in order and to have your ideas organized. And that's a good way to work. And it's a good way to provide things and improve our treatment and our diagnosis for patients.
Thank you for listening to this episode of EAU Podcasts. To keep up to date with the development of functional urology, visit our educational platform, UroLuts. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.